Well, listen to this next story. Malaria prevalence in the country has reduced by 2% in the last 5 years. A malaria indicator survey released Wednesday shows that in 2015, the disease prevalence was at 8%, but dropped to 6% in 2020 in children aged between 6 months and 14 years. The Ministry of Health attributes the reduction in the prevalence to investment in robust preventive measures. And as our very own Elphas Lagas reports, the lake endemic regions are still recording the highest malaria prevalence. Take a listen.
With the prevalence of malaria reducing from 8 to 6% in a span of 5 years, Kenya's health ministry remains optimistic of eradicating the disease by 2030. This means that Kenya, which currently has an estimated 3.5 million malaria cases and 10,700 deaths annually, has a 9-year window to achieve this milestone.
But the most important thing is that the numbers are going down. And also, malaria is no longer the leading cause of outpatient visits in Kenya. It's now number 2 after respiratory diseases.
During the launch of the Malaria Indicator Survey of 2020 Wednesday morning, health officials revealed that malaria prevalence is still high among rural children compared to their counterparts in urban settings. The percentages standing at 7% and 3% respectively.
3 to 4 years it increased to 4%, and it peaked at children 10 to 14 years who had a malaria prevalence of 8%. But overall, the prevalence was 6%.
Counties including Kisumu, Siaya, Migori, Homa Bay, Kakamega, Busia, Bungoma and Vihiga, classified as the lake endemic regions, still account for the highest malaria prevalence in the country at 19%.
We want to tap into local resources. We want to go beyond depending on donors to support our efforts in malaria. We want sustainable funding. And he has committed to see that 15 countries in Africa establish End Malaria Council and funds by the end of his term.
Kenya is targeting to eliminate malaria disease in the country by 2030. Health authorities have purposed to start by eliminating malaria in 4 counties with the lowest prevalence, including Nyeri, Laikipia, Nyandarua and Kirinyaga. Early October, the World Health Organization (WHO) approved a vaccine to be used against malaria. The RTSS has potential of being a major milestone in the fight against a disease that kills thousands of children annually, especially in sub-Saharan Africa. Some 2 million doses of RTSS malaria vaccine have been administered to infants in Kenya, Malawi and Ghana on a large-scale pilot phase through the coordination of WHO since 2019. Elphas Lagas, Citizen TV, Nairobi.